Right, and talking about regulations, I mean, there's some people who be like, and I'm pretty sure Eunice, you've encountered these people who are like, fine, number one, I do not want to get vaccinated, but it doesn't mean I expose myself, right? It doesn't mean that I'm just out here walking around with no mask, walking around, not sanitized, not observing all these measures. I am observing these measures. I am masking up when I'm in a public place, but at the same time, I have my concerns. I mean, others who are like, for religious purposes, I do not want to be vaccinated. So in terms of then, fine, and we understand that you also have to look at the public interest in terms of protecting all these people, especially the big, population of people who have been vaccinated. But then again, also those ones who do not want to get vaccinated. Eunice, what do you have to say to that? Because again, Dr. Akwale, together with the entire ministry, is like we have to protect people at all costs. But then again, who then protects this other group of people who are like, I do not want to get vaccinated?
Thank you, Winnie. And before I answer your question, where these are concerns, I feel like the Ministry of Health is shifting the blame to, or rather the responsibility to the people. Like it is your job to protect other people. And then again, I also feel like there's the notion of top to down kind of business with the vaccines. I would like to understand from Daktari, what is the government doing? What is the government doing to ensure that at least we are having the community involved in all this? Instead of as much as we have the public health, which I, as a health journalist, really know it is very important. But how do you communicate with the other half that says, I do not want to be vaccinated? Then still on it, I'd also like Daktari to explain to us, because he's talked about the more people are vaccinated, the more we are protecting the community. The other aspect, the other argument I'll ask, how about the more people are infected, the more we have a natural immunity after the infection? And I still look at how the government moved with the chain of command, or rather chain of management, matters HIV. And we are now doing HIV programs, involving the community. We are having them form their own decisions because they are a group from the ground. But we are having even countries, let's give an example of Kenya. We have women, living with HIV, and they have their own community, and they can inform the rest because they've been enlightened. I still feel like the Ministry of Health is not really involving the people in this, but the people are being blamed why they're not taking the vaccines. We have countries that are doing door-to-door vaccination, vaccinating their people against COVID-19. Daktari talked about the cold chain. How is it a Kenyan problem who is at home and being told to go to, leave my job? Well, some of them are business women. They have to leave their businesses to go and get vaccinated at a facility. Why can't the government make this vaccination easier for them? Why should I go and line up, maybe in Bagathi or Kenyatta National Hospital? Why can't you bring this vaccination to me, like they do with polio vaccine? And then I'd also like to hear from the government. We have a lot of vaccines, We have a lot of vaccines. Since we started receiving these vaccines on 3rd March, that midnight, I was at the airport. Do we have vaccines that have expired? Have we had cases of expired vaccines? Because I remember last year, before WHO Africa, they closed for the season, they mentioned that 9 million vaccines in total had expired in Africa. So do we have such situation in Kenya? And how are we protecting the people? Matters, if at all, the government will respond if we have the expired vaccines. How are we protecting people against such? But I really want to know, why can't we take these vaccines to the people? Why do we have to string people to go to the facility? So that at least it can be easier. Let's meet 50-50, meet me halfway. Make it easier for me. You want me to be vaccinated, make it easier for me.
Yeah,
like you do with polio.
Yeah, because, Dr. Akwale talked about an aspect of balancing. Yes, get vaccinated, but also at the same time, making sure that you do not put other people at risk of the same. So, Dr. Akwale.
Okay. Thank you. I think there are important issues there that I need to talk to. And the first one is the issue of access. And Eunice will agree with me. Last year, you saw us at bus terminals. You've seen us in churches. You've seen us targeting the elderly. In fact, go and look at the data for Kakamega County, where they really employed access to the population. And you've seen the increase in that. In the uptake, and now Kakamega actually is the 4th best vaccinated from 23 within a month.
Nice.
But you realize every county has different. The same measures were employed elsewhere, and you may have other factors coming in. And I also really want to say, remember, polio is oral. These are injectable. One of the things people should know, infectious prevention control as part of COVID-19 is a very key element. Remember, you are using syringes and needles, and the blood from that could start spreading infections within community. So these are factors that one has to take into consideration. And then, as I've said, the carrier boxes, the cold chain that you have to do the outreaches with is also a very important thing to ensure that that is maintained. I know the countries where you are hearing high population, they have different characteristics. Mauritius, Seychelles, almost 100%. These are small geographies that can. And you can see even here in Kenya, like Kipia is doing very well, small areas. But we ensure we address this. We are not saying that one measure is what we are concentrating on. We are going with all those measures. Now, you raised the issue of natural infection, and that is an important one. If natural infection was conferring a lot of immunity to people, then the people in the Northern Hemisphere, America, Europe, would actually have already got all that protection. Yet now, as we know, that is where the burden is highest. And right from the beginning of this pandemic, it was discovered that 3 to 4 months after the first infection, people are getting infected again. That was a very clear indication that natural immunity is not fully protective. And then I have always said there is what you call an ethical question. Because we know the case fatality rate of this infection could be anywhere between 3 to 6%, meaning out of 100 people, maybe 5 will die. So if we tell people, wait until you're infected, who are those 5 who are supposed to die? Is it me or you, Eunice? So again, but what we know, vaccination immunity, first, it has given a 6 months protection. Then there's evidence of it waning. And the best evidence came from Israel late last year, where the number of people who had breakthrough infection and had to be admitted, 90% had not received their booster doses. And that's why now we are really emphasizing on the need of a booster dose. That evidence is basically there. Then I think one of the things, and this is really my final point at this, we are not saying government is pushing people to do, but public health, actually you have to work through people. And you get different experiences. HIV/AIDS is a chronic disease. We are now dealing with a highly infectious global pandemic whose responses must really be constant across the globe. Because if there is fire in America, we are not safe. Tourists will be here the next day. We are a tourist destination. People will be coming here for business, and we are on fire the next day. So there are differences between what a lot of us had used to for many years in public health, chronic. There are lessons to learn there, but we also have lessons that we are learning with a highly infectious disease and measures that need to be put in place. Thank you.
All right, and there's a lot of concern about the herd immunity, and like Eunice rightly put, I mean, why not, all right? But of course, there's a lot of controversy surrounding the same. But Dr. Akwali, I think probably you'll answer this after Professor Julius, about the aspect of, fine, we are encouraging people to go for their booster shots. But then again, there's some counties where the level of vaccination is still relatively low. I mean, according to the graphics that Eunice prepared for us, which I think we'll have on the screen, and Eunice will take us through some of this, especially some of the counties that are least vaccinated as compared to, the others. There we go. Eunice, you want to take us through that very quickly?
Okay, back to the vaccines and the Kenya's vaccination campaign. So we have, as I mentioned earlier, the urban towns or other urban counties show a high percentage in terms of the vaccination uptake. Nairobi leading at 1.1 billion, that is 37.9%. Then we have Nyeri at 180,246 people who've been, vaccinated. Then you have Laikipia at 88,265, that is 28.8%. It's safe to say in Laikipia, at least 3 out of 10 people have been vaccinated. Kakamega, as Dr. Kwale had mentioned earlier, I think the drive that they had, involving the community, gave it a boost. So we have around 255,138 people who've been vaccinated. Then in Kiambu, we have 419,490 people. This is safe to say, Daktari, in Kiambu, at least 1 out of 4 people have been vaccinated in Kiambu County. Then we have counties that have, performed poorly in terms of vaccination uptake. We have Marsabit, for only 14,000 people. That's around 6.6%. We have Mandera. We have Turkana, which has 24,428. Then Wajir, which has 17,263. Tana River, 6,874. And I'd like perhaps Dr. Akwale will explain to us what measures are they making to ensure that they're put in place to ensure that these counties, the northeastern part of the country, are reached and they're not secluded, because as much as we're talking about the Public Health Act, then let us look at the Constitution. Everybody has a right to proper health care. So these people, I feel there's more that needs to be done to ensure that they are fully vaccinated in order to achieve the herd immunity that Dr. Adi was talking about.
Yeah. And of course, we'll also look at the booster shots, which I think Dr. Akwale is really, really emphasizing on, as far as the booster shots. And there we go on the screen.
Yeah, we have the highest counties. With the counties with the highest number of people who've shown up for the booster shot. Well, we are still doing low, because we are about at total of about 100,000 people who've shown up for their booster shots. And well, Nairobi leading, I think, because of the proximity to these vaccination centers. And then there's also the issue of the number of vaccination centers that we have in a county. Nairobi has a high number of them. So we have 54,000 people, 862 who've shown up for the booster shots. Nakuru at 8,213, Uasin Gishu at 5,747. We have Kiambu, 5,576, and we have Mombasa, 4,991. And basically, still, if you look at the counties that have registered this high number of people who've gone for their booster shots, it resonates also with the number of people who've been fully vaccinated. And most of them are these urban counties. So I think we still have more to do. Then we have counties with the lowest number of booster shots. Garissa at 33, Tana River at 22, Lamu at 12, Mandera 9, and Wajir 0. And the same concern in regards to, I think the Ministry of Health needs to highlight and explain to us why are we talking about a herd immunity and we still have counties that have not had booster shots? Is it that we do not have enough vaccines, which I know are there, or is it that we are not doing more campaign? We have a lot of vaccines, 24 million vaccines. I'd really like to understand.
I'll explain.
Yes, I'd really like to understand how are we going to help my sister in Wajir get vaccinated?
I totally will explain.
Yes.